Hello, and welcome to another edition of BNEWS In Depth. I'm your host, Rich Hosford. Despite the rollout of the vaccines earlier this year, cases of COVID-19 are ticking back up, mostly fueled by the Delta variant. In response, some institutions, including Massachusetts schools, are going back to mask mandates. Some cities and towns are also requiring masks to be worn in municipal buildings and businesses. The rise of cases after initial hope that we were putting this pandemic behind us is causing quite a bit of confusion. To help sort it out, we are focusing our show this month on the current situation and what people need to know. We'll start with a conversation with Board of Health Chair Dr. Ed Weiner and Burlington Health Director Susan Lumenello about the variant, current guidance, and what people should do to protect themselves and their loved ones. Following that, we'll talk to State Rep Ken Gordon about what assistance is available or may become available at the state and federal level. We have a lot to get to, so let's get started. And I am now joined by two people who are on the front lines of this pandemic for the past year and a half. Burlington Health Director Susan Lumenello and Board of Health Chair Dr. Edward Weiner. Both of you, thank you for taking some time. I know you're both very busy, but this is a good opportunity to sort of get people caught up about what's going on with this virus.
Doesn't stop. We never expected it to be a year and a half. And
No.
people are getting tired, and I understand that. But I think the most important statement I can make is we got to stay vigilant. We thought it was over, and now we have a Delta variant. We may even have other variants, but we got to stay vigilant. We have a different lifestyle now, one that's probably not going to go away for quite a while. And things continue to change, and we have to change with the environment and with the situation. And we'll talk a little bit today about the confusion between the state, between CDC, and what we need to do as a Board of Health, because they don't want to come to any agreement. And the state doesn't, in some cases, want to take full responsibility. We at the Board of Health in Burlington will, because our most important duty is to work to keep the community safe. And we have a great director, and she can update us a little bit, but it's frustrating for everybody.
Well, Dr. Weiner, sorry, Susan, go ahead.
I just wanted to say, I think that's a good point, that people need to stay vigilant. That means that they need to continue to be aware of, if they have any symptoms at all, that they should get tested for COVID, and they can continue to watch the data. If they go to the state's website, there's a data tracker. You can go to the Board of Health website. On the left-hand side, there's a link for COVID. It will direct you to the state's data tracker. If people are interested in seeing what the numbers are currently now in the state and in Burlington, and compare Burlington to other communities, compare counties, and look at different types of data metrics, this is a great place to go. The numbers are increasing, as everybody knows. The numbers are starting to go up. So it is important to remain vigilant throughout this whole thing and continue to know the situation and to continue to watch yourself for symptoms. And if the Board of Health calls you, because we are still doing contact tracing, we're still doing communicable disease investigation, and if you test positive, we will call you to walk you through the isolation and quarantine requirements. It's important to stay home if you have symptoms and you test positive. And not go out into the community, regardless of whether or not you're vaccinated. There is some cases of breakthrough COVID in vaccinated people. So even if you are vaccinated, if you have symptoms, you should get yourself tested.
Yes, absolutely. Dr. Weiner, so you mentioned the Delta variant, and I don't want to get too into the weeds of the science, but can you just sort of, maybe for people who don't understand, explain like what it means by having a new variant of the same kind of virus that we've been dealing with all this time?
Viruses evolve, just like any animal species. Although viruses are not animals and they're not plants, they're a group unto themselves, but they change. That's why we have a different flu vaccine every year. I think that's a good example because those viruses change, their DNA or their RNA, whatever types of viruses they are, they change as they grow and as they evolve, as we talk about evolution. This is what happened with COVID. We have a COVID-19 virus, which changed a little bit. And this change caused even more infectivity and caused situation where it caused a different variant of the disease. People who have been vaccinated, the vaccine covers and protects through our immune system what we originally built those vaccines for, but this vaccine is a little different. So people can still get sick. Not as sick as they would if they weren't vaccinated. And to use that as a springboard, the most important thing that you can do, if you haven't, is to get vaccinated. On the Board of Health, we talked last night. I know for some people this is a political issue. I know for some people they think that this is a loss of freedom to get vaccinated or to be mandated. But you have family, you have friends, you have colleagues. This protects not only you, but it protects them. And we don't want you sick. We don't want them sick. We don't want anybody to die. And yes, there are still deaths taking place in this country and this community. Get vaccinated. And we did it for polio. We did it for smallpox. We did it for measles, mumps, rubella. We did it for so many things. And we do it every year for the flu. Get vaccinated if you haven't. It's not about you, it's about everybody.
And now, so the news this week is that the Pfizer vaccine is no longer under emergency use authorization. There's news that Moderna will probably get, fully approved within the next couple of weeks. What does that signify for people who maybe are, were hesitant or reluctant to get this vaccine or one of these vaccines?
Susan, shall I take that or would you like?
Go ahead.
We created this vaccine, we being the pharmaceutical companies of the world, created a vaccine for this virus in record time. Record time never seen before, but it takes a while for the FDA to review the history of what happens when a vaccine is developed and looks into what they call a real world experience, and they look into that and they say, look, now we had an emergency situation which we said everybody needs this. We haven't completely looked at it. Now we're looking at it, and we looked at the real world data, and we show that these vaccines are safe. There are side effects every million or billion, but there are a few side effects. We all know that. But the benefit surely outweighs the risk. And now that they have said it's safe, get it. So people who've been waiting because they were a little worried about the safety of these viruses now can be assured that they are safe. So if you've been waiting, get your vaccine now. And you can get your vaccine at so many places. I think that the federal government said there are 80,000 sites around the country where you can get the vaccine, and it's not gonna cost you. From what I understand, there is no charge. 80,000 sites. Stop somewhere and get the vaccine.
Yeah. Right now, I mean, they have almost a surplus of them, so it's not like back in the early days where people were waiting in line to get them. Now it's everywhere. Just staying on the vaccine for just another minute, so you say, because of what the research shows that it's safe, but the efficiency seems to be kind of dropping a little bit. And talk about like the possible need for people to get a third booster shot.
Well, as part of the surveillance and the research and looking at the data from the time we have offered these vaccines now, I'm trying to think how many months, it must be 8 or 9 months now that we've offered the vaccine, that we see that immunity is waning a little bit. And now we have approval for a third dose. Right at this moment, there are specific populations of the very sick, of the immunocompromised, and we will soon see many, many more groups that will be eligible for a third dose. So the research has shown that if you get a third dose, your immunity climbs even higher. And that's where we are now in the surveillance and the history and the watching this, the data from the virus from millions and millions and millions of people and their reaction. We see that we may need a third dose. And you know what? We get a dose of flu vaccine every year. Why? Because it changes a little bit, and we want to make sure our immunity is what it is. For this particular virus, we might need a third shot.
Right.
And who knows? We might need one every year.
And just to add to that, Rich,
Yes,
so the Department of Public Health has distinguished between what they're calling a third dose and a booster vaccination. So the third dose is, even though it's the same vaccine, is describing if you're right now, if people who are immunocompromised or have certain conditions can get that third dose. And the recommendation is to, if you fall into that category, is to go to your doctor, have a discussion with your doctor to see if you need to get that third dose. So for people right now, it's approved for people who are in that category, and they should have that discussion with their doctors about getting the third dose. At the end of August, the ACIP is meeting to discuss the booster doses for people who do not fall into that category. So that would be, and that would be those people who have gotten the second dose who are not immunocompromised. And we will know more about the booster dose after the ACIP meeting at the end of August, because they are expected to make recommendations on the booster dose. One other thing, if you have had, if you fall into that third category, you're going to have a discussion with your doctor. Hopefully it's your doctor that's going to administer that third dose to you. If you did get Pfizer before, if you got Moderna before, you should try to stick to that as being the dose that you continue to get.
Okay, so it's good to kind of.
That's the recommendation.
Right,
You
stay the
can't
course.
do that. That's another thing, you should have a discussion with your doctor about that.
Okay. So we talked about vaccines, and obviously recommendation is for people to get it and then follow up with their doctor in case they need more. The other kind of major protection that we have is the wearing of masks, which again has become sort of a sticky situation in a lot of places. Susan, last night at the Board of Health meeting, and maybe you can explain this, there's a little bit of difference between the federal and state level recommendations about mask wearing. Can you kind of explain the situation?
Yeah, so there's a CDC recommendation and then a recommendation from the Mass Department of Public Health. So the CDC is recommending that everyone wear masks in an indoor situation, whether vaccinated or not. The Mass Department of Public Health has not gone that far. They're saying if you are unvaccinated or if you are immunocompromised and vaccinated, then you should wear a mask indoors. So it's a little bit different, which the Department of Public Health hasn't gone as far as the CDC in saying that everyone should be masked indoors. And the reason for that, is, which the Department of Public Health has said, is that our vaccination rates are higher in Massachusetts than in other parts of the country.
So it's basically obviously the CDC has to sort of address the entire nation as a whole rather than state by state situations.
Yeah, but last night at the Board of Health meeting, part of our discussion about this was, and the Board of Health, I think, was in a consensus on this, is that the Board of Health as a group would advise everyone to wear masks indoors. So from the Board of Health, their standpoint is to go with the CDC recommendation on mask wearing, which states that a fully vaccinated person should wear a mask or face covering when indoors if you have a weakened immune system, or that's from the Department of Public Health. But the CDC says fully vaccinated people should wear masks indoors in a substantial or high transmission area, which Middlesex County is a substantial transmission area.
Dr. Weiner, so I know last night you kind of mentioned reluctance for a mandate. Some communities in the state, are now requiring masks when inside of businesses, inside municipal buildings. I know like Billerica, for example, just put that in place. Salem, Massachusetts, where I live, has that start since this past Monday. Why not just go ahead and make a mandate that, if you're in a business in Burlington, you have to wear a mask?
Dr. Saltzman put it very well last night. I think that he said that he felt that there needed to be some, and there is some, community responsibility. Everybody needs to take some responsibility. And he felt that people within this community are very smart, people in this community are very responsible, and so are our businesses. And he felt, in advising us, that at this point in time, it would be better to keep surveillance. And if it's not working, then the Board of Health can make that major determination to recommend masks or actually mandate masks throughout the community. And we set up a subcommittee, a COVID-19 subcommittee last night, in which I will be part of, as well as Dr. Saltzman and maybe some others, who will look at the data every single week, and we will look at it. And if the community is not being responsible, and I think it is, or if we're seeing a lot of changes in terms of COVID within this community, then we will take that major step for mandate. But this is a very diverse community, as you know. We have a plethora of offices here, community offices, headquarters, national headquarters. We have so much business. We have multiple malls. We have so much going on that we felt that to take this major step, we would really want to make sure that it is necessary. And he advised us of that. And he's a very smart guy, and he's very experienced, and I feel the same way. And I think that we will look at this every single week with the people involved, clinicians and public health individuals, and we'll make a decision if we need to go in that direction. The schools have already done that.
Yeah, we're going to get there.
The schools have already done that. Our schools, we have a state mandate now for masks in the schools through October. As Susan said, there is confusion in our Commonwealth of Massachusetts. Our governor originally said that you should be masked in counties that had significant transmission. Well, every county in the Commonwealth of Massachusetts has significant transmission, and he has been reluctant to give that mandate to everybody within the state. So we are going to look at it because they're not going to take that responsibility. We're going to look at it, keep a great eye on it, and ultimately, if we need to make that decision, we will. Susan, any comment on that?
Yeah, I think a couple of points that were brought up last night, which were substantial, was the idea of, personal responsibility, people realizing when they should wear a mask, and also I think David brought it up, McSweeney, about situational things that come up with wearing a mask. So if you're going into a crowded place, whether or not you're vaccinated or unvaccinated, whether you're in a town that has a mask mandate or a town that doesn't have a mask mandate, you should wear a mask to protect yourself as well. So it's a protection for others, for protection for your family, and protection for yourself. So people need to realize that whether you're going from one town that has a mask mandate, or a town that doesn't have a mask mandate, you need to decide for yourself, should I wear a mask in here? And if it's a crowded area where you cannot socially distance and you're around a lot of people, you should be wearing a mask.
Right. And one of the other things that came up at the meeting last night was sort of a call out for input from the community, because, I think we all agree, like Dr. Weiner, you said, that we have a responsible community here in Burlington, but also, we have, with all the shopping and international business here, we have people coming from all over into the community. And maybe that is making some people a little bit more nervous about, being out in public, and maybe they'd want a mandate or some more guidance. What are you hoping to hear from, residents about their thoughts on, what the direction of the Board of Health might be?
Well, we hear from the community. We always hear from them. I can tell you, Rich, my phone is very busy, and we have a full staff at the Board of Health, and they take lots and lots of calls. So I urge you, if you feel one way or the other, I think you need to call the Board of Health and make a statement. I think you need to get on our meetings. It was wonderful last night to see a local noted pediatrician who joined us to talk about the schools. We had the school superintendent, the assistant superintendent last night. This is a very complicated matter, and we have helped keep this community safe, and we'll still try to do that. But we're not the community. The community needs to call us and to talk to us about it. I for the first time in my life, I got on Facebook, and there's all kinds of arguments one way and the other. We will look at the data. Look at the science, and I think that's the key here. The Board of Health will look at the science and make those decisions. And those decisions are not small decisions. They're pretty tough decisions. So we're going to look at it regularly, and if things change, I even said last night we'd have a special Board of Health meeting if necessary. So to that end, I think we're doing the best we can.
Yeah. Well, you mentioned Facebook, so just your comment on, maybe this can go to either one of you. Obviously there's a lot of misinformation out there. Where would you recommend people go to get trusted information that they can actually rely on and that is accurate?
I'll just start, but I'm going to give it to Susan because she's the expert on that. Look, Facebook and social media is not science. It is not official. You need to go to trusted sites to get your information. And Susan can talk about all those trusted sites. There are a number of them out there, and easy access for everybody, even a phone call away. If you don't have a computer, if you can't get information, you can call the Board of Health. We will be happy to give you the information you need. But please understand, there's a lot of misinformation on social media. I think we talked about, Rich, last night about somebody scaring everybody with dihydroxide, which is water in vaccines. Well, there's water in all of life. So it's not a contaminant. The bottom line here is we have lots of places to get good information, and our Director of Public Health knows where they all are.
Yeah, I would recommend that people stop by our website, the Board of Health website, because we have links from our website to the trusted sources, which would be Department of Public. I'd tell people to start with the Massachusetts Department of Public Health websites, the CDC websites. I think some of the problem is that things change so much. Things are changing. Things have been changing for the last year and a half on this so quickly. And there's misinformation around that, but then there's also people trying to keep themselves up to date with the most recent information, and that can be difficult with the way things change. So looking back frequently, checking on it, maybe not going by what you hear, what somebody said, just trying to find out the information for yourself from the trusted sites. And I also too, like I mentioned before, is the data tracker. There's a lot of information on there. It can tell you the overall trends in the state, in our city and town, and other cities and towns. So if people go there, they can find out the information there. If there's a lot of information there. So we at the Board of Health are taking phone calls. I walked somebody through the data site yesterday, so we're happy to do that. If somebody wants to call up the Board of Health, we'll help them find the information that they're looking for.
All right. Well, I just got a notice from Zoom that we have about 9 minutes left before this interview closes down. So I just wanted to end with the schools. So I know, Susan, you've been working with Dr. Conti and Mr. Larkin. What are some of the things that the schools are doing that are going to try to help keep all the kids safe?
So the schools, of course, they need to follow the DESE requirements, and one of those that we discussed last night was that they can no longer do the remote learning. So everyone needs to be back into school, which, of course, presents more challenges this year with getting everybody back into the classroom. So DESE and Department of Public Health released a joint memo for the schools on how they can do that. So when we talk about confusion, that has kind of created some confusion in that the definition of a close contact is now different in schools than it is outside of school. So the close contact for a school is within 3 feet for 15 minutes or more. If you're out of school and you're not in a classroom, then the close contact definition that Department of Public Health uses is within 6 feet for 15 minutes or more. And that's the close contact definition that we've been using all along, but now there's going to be a change for the schools. So if we have a positive case in a school, anyone within 3 feet of that positive case would be considered a close contact and would need to stay out of school. If they're beyond 3 feet, if they're from 3 to 6 feet, they would be able to return to school. So that is one of the big differences I think is going to cause, as I was saying last night, cause confusion amongst people because of the difference between in school and out of school. People need to understand if you're a close contact, you could come down with COVID anytime within the next 14 days, and you should be quarantining.
Right.
So, and if you're back in school, even if you're allowed to go back into the classroom, because DESE has said you can, you should not be outside of school going other places. Right. So there's going to be a lot of confusion, I think, over that. We're going to have to do some education with people who test positive and people who are close contacts.
Right. So just because I think this is sort of a confusing thing, I want to put it simply and make sure that I understand it, and then you can tell me if I'm right or wrong. But my understanding is if you're in school and you're 5 feet away from somebody who's a close contact, you can continue going to school, you can go to school events, but because you're within 6 feet, you shouldn't be going to karate class or any, the dance studio outside of school.
That's correct. So the Board of Health, so we're going to treat those people within 6 feet the same way outside of school, the same way we would anybody else. So if you're within 5 feet, maybe you can go back to school because Desi says you can go back to school, but you really should not be going anywhere else. You really should be staying home after school until that isolation period is over, or you get tested on day 5 after exposure. And if you're negative, you can go back to your normal activities on day 8. So that's the criteria that we have used all along, which we're going to continue to use, but they can still go back to the classroom. And of course, if they have symptoms, they should not go back. They should stay home and get tested.
Yeah, clearly. And then after October 1st, the situation with schools changes. So maybe middle school and high school students who are vaccinated can drop the masks, or is that going to be looked at locally different? I know that's what the state said, but how is that going to play out here in Burlington? Any sort of thoughts on that?
We'd have to look at it at the time.
Mm-hmm.
I think that, as you can see, the chaos in the Commonwealth, I call it, and because there's chaos in the Commonwealth, if we have to make those decisions, the Burlington Board of Health will make those decisions. I will hope that DESE and the Department of Public Health comes to some type of agreement. I hope the governor brings everybody together and has one set of rules that are not confusing. But if they don't do that, we will. Because our responsibility is this community, and we've been pretty successful in keeping this community safe, and we'll do that. That's what I'm charged with doing, and that's what my board is, and Susan Lumenello and her staff. So,
all right. Well,
one other thing,
mm-hmm.
Rich. Town development, food establishments, restaurants, the environment, many other communicable diseases. I could go on and on and on. We talk about COVID in the Board of Health, but I got to tell you, there are so many other duties and so many other diverse things that we have to do that we cannot let up. We've got to do it all. So I don't want anyone to think that we are not watching what's happening when you go to lunch or when you go to dinner. What's happening in the development and the building, what's going on in this community, or the environment. On top of all of that, we are handling COVID. And I know we have a large Board of Health, but we're all really busy. So thank you, Richard. I want to thank you, and I want to thank BCAT for getting the word out, because in many ways, you are the mode of communication from this town.
Well, I want to thank both of you. I know there's a lot going on. There's a lot of different messages coming out. People are a little confused, and I think, just taking the time to really kind of drill down into it was very helpful, and I hope people kind of watch this program and take away that, even though it might be confusing, the Board of Health is on it. People are monitoring the situation and putting out the best advice that they possibly can, and I want to thank both of you for doing that and for being part of this show this week or this month.
Thank you.
Thanks, Rich.
All right. I'm sure we'll have you back on, and we'll talk to you then.
Thank you.
We go now to my conversation with State Rep Ken Gordon about actions being taken on the state and federal level to provide assistance to those impacted by the pandemic. And I am now joined by State Representative Ken Gordon to talk about some of the assistance in possible future legislation to help people kind of get through this as the cases continue to tick back up. Ken, thanks for taking some time.
Thank you, Rich. Thank you for having me. I appreciate it.
I just wanted to start just your overall general impressions of where we are right now.
Well, it's a very trying time because here in Massachusetts, we're taking the vaccination seriously. The numbers are high. We're doing well, but we see with the Delta variant, the risk has been reintroduced, and we're taking new precautions. We're wearing masks again and things like that. And so people are likely again going to be looking into housing insecurity, and we're continuing to do that in the House. And so we're trying to take a balanced approach so that we're solving problems and not really that we don't have what we call unintended consequences, which I really think means we just didn't think through potential consequences of the things that we do.
And you mentioned housing insecurity, and I mean, that is sort of the news of the day. Like yesterday, the Supreme Court overturned a Biden policy to extend the eviction moratorium. Is there anything else that can be done at the federal level, and is there anything that can be done at the state level, or is in the works, or is already in place?
Yeah, thank you for asking that. So what the Supreme Court said was essentially that the Biden administration, as the executive branch of the federal government, didn't have the authority to issue the orders that it did. And it said that Congress has that authority, and Congress didn't act. So it said what could be done. Well, Congress could act and could really provide the same sort of relief on a federal level that the administration tried to do. We're not holding our breath waiting for Congress to act in Massachusetts. So we do have pending legislation. It was heard just 2 weeks ago that would, in fact, create a moratorium that would go until March of 2022. But it's not just a blanket moratorium on any eviction. What it really does is it just says that if a landlord is not getting the rent, that there are certain conditions that have to be followed, that the landlord has to give the tenant an opportunity to seek assistance from the state. We can talk about what that assistance would be. If the inability to pay rent is due solely to a condition caused by COVID, then there are steps that the tenant can take to alleviate that situation, and the landlord just has to give the tenant an opportunity to do that.
And what kind, is it what's sort of the outline of the process for that people would have to undergo if they do find themselves in that situation?
Well, even now, the process is that there's an application that would go to the relevant agency. Right now, we have an agency that has jurisdiction here. We can talk about that. But you would apply for assistance, and families would be advised as to the proper places to go for that. Whether that be under a proposed legislation that that's not passed into law yet, or the relief that is currently available.
Now, I know some people, when they think landlord, they think big corporation that owns huge apartment complexes, and they don't really that sympathetic, I would imagine, to that entity. But there are a lot of landlords are just families that own a second property that they have put work into. Is there assistance for them as well? Is it something that they can do directly without relying on the tenants?
Well, there were different things that were going on. There's no direct assistance for a property owner, for example, to get money directly from the state. First of all, you're right that our housing and our rental market involves a lot of different types of interests and entities. And so you're right that it's not always sort of a big corporate landlord on a big apartment complex. Although those businesses have their own challenges. But you're right, there are many instances where we have just a person with a two-family house. We have instances where people have property on the Cape, things like that they're renting. And some of the laws that were in place, the rules and regulations in place during the pandemic, didn't really distinguish even between Cape rental property, which was seasonal, and the types of property that people were renting in order to have their permanent house, their permanent home. So all of this requires a close look to make sure we're doing the right thing in each of these instances.
Okay. And obviously, the economy, businesses are back open, but there's, if, as things progress, maybe people will be more hesitant to go back outside again, especially as we get into the winter. What's the sort of the current situation with any assistance for, small businesses, the local coffee shop, kind of that type of entity?
We know that we have federal funding coming in through the emergency programs, and we have, and we're looking together with the governor on where we can best spend that funding. Some of it is going to help with the homelessness, the potential homelessness situation. Others are going to help not only directly to those types of businesses that you mentioned, but also to the municipalities so that they can help those businesses. We'll certainly have a more detailed plan very soon.
Okay. One of the things that you keep hearing about in the news is, a lot of people who were maybe restaurant workers or working in industries that were hit pretty hard by the pandemic are not returning to work, but are seeking other employment. Are there programs out there that you are aware of to sort of help people find new types of employment?
Oh, sure. And there are several educational and training programs that are available to workers that are looking for either a new career or just some training within their own career that they may be missing, and they can go to their job centers for that. If they're on unemployment, especially, they go to their local career center, and that's a good entree into those types of programs. They've been funded for a while. Some of them are employer funded. In other words, the employers are putting money into a trust fund so that all of them can obtain that type of trained worker, so it benefits them. And some of it is state funded.
And this isn't exactly COVID related, but there are two bills going through at the federal level. One that actually looks like it has bipartisan agreement to some extent for infrastructure, and then a larger, probably Democrat only, reconciliation bill to have human infrastructure, as I think is how they're wording it. When you look at those bills, how do you think if they were to pass, would impact here locally in Massachusetts?
Well, I really think what we're doing in the legislature is we're going to look, I think the word might be holistically, if that means that we're taking a large view and having our committees study what we can do best. So it may not be that we pass, that any one bill reflects the plan that comes out of the legislature in this session. We'll take the best of any number of ideas, but that really is what we're trying to do. Is we've got to look at our infrastructure, human infrastructure, meaning that it's the people here in Massachusetts through education and training that is the engine that drives us here. And we'll never forget that the reason that businesses come to Massachusetts and help our economy to flourish is because they have access to our educated workforce, access to our workforce that's always been engaged. Our schools have always been engaged. Our schools have always been among the best in the country. And as long as we continue to invest in that, then we'll do okay.
Now, got some construction going on in the school. I know that there's always a lot of different versatile things that you're working on, and I've touched on what I kind of expected us to talk about. But are there other things that sort of topics or points of interest that we have not discussed yet?
With respect to COVID and our COVID recovery?
Yeah, kind of like the current situation that we're in.
Yes, so there are a couple of programs that I'm working on as to bills I've filed, and one is that you mentioned the frustration that some businesses are having in getting workers returning to work. I think one of the biggest problems that's always existed, but it exists more so, is with childcare. During COVID, one situation that occurs, a lot of people worked from home and they provided their own childcare. And now they're being asked to work away from home. And so I think some people are looking at the very costly obligations that they have, unless there's family nearby, and they're saying, I'm not sure if this is worth it. I'm not sure that the very expensive cost of childcare, coupled with the fact that I'd rather be home with my child, I've had a taste for that, is enough to get people back to the workplace. So what we've got to do is provide more affordable and reliable childcare. So I filed a bill together with some of my colleagues. We've got, I think, a majority of our legislators signed on to it already. That would revamp how we look at providing childcare to every family here in Massachusetts by giving a sliding scale benefit to our families and giving a direct benefit to the childcare providers. So the providers know that they can keep the doors open, so that the families know that they can better afford the childcare because it will be tied into their income in the same way that the U.S. military does it. They tie the fees that families are expected to pay. And the other thing that it does is it protects our the teachers in the preschools, because they're among the lowest paid workers in the state, and the responsibility for our young children is immense, keeping them safe and well educated. Because, I mean, I guess I could go on this because it's so important to me, but children that have the opportunity to get preschool education are by far better prepared for school, not just kindergarten and first grade, but all the way through K through 12 and then college. And it makes for a better life. The studies have shown that these kids have an advantage. And so every kid in Massachusetts should have that advantage to have access to that preschool education. So it helps families, helps businesses because it will open the labor market, and helps the kids. So that's a program I've worked on. And as chair of the House chair of the Joint Committee on Public Service, we're also looking at ways to help people who have been struggling through the pandemic, those that have gone out of their home to work because they've been essential workers, and what we can do to address some of the contributions that they've made.
Okay. Well, it sounds like you're quite busy, so I can let you get back to it. But as always, I appreciate you taking some time and talking with us and kind of going through the current issues of the day.
You know what, and as always, Rich, thank you for what you do, because by keeping the people of Burlington informed of these, you're providing a tremendous public service. And to get this reliable information that you provide, it's hard to find. Many towns don't have this benefit. So thank you very much to you, to BCAT, to the whole new staff, and to the whole station for doing what you do.
Well, thank you very much. We appreciate it. And I'm sure we'll have you back on, and we'll talk to you soon.
Anytime. Thanks, Rich.
Thank you. So there you have it, a look at the key information people should have during this time of the Delta variant. I'd like to thank my guests, Board of Health Chair Dr. Ed Weiner, Health Director Susan Lumenello, and State Rep Ken Gordon. I'd also like to thank all of you for watching. We'll be back next month with another edition of BNEWS In Depth, so stay tuned.